Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the cervical vertebrae. We have 7 cervical vertebrae: 1, 2, 3, 4, 5, 6, 7, and the third, fourth, fifth, and sixth cervical vertebra are typical cervical vertebra. Therefore, the first, second, and seventh cervical vertebra are atypical cervical vertebra. First cervical vertebra is called the atlas, second cervical vertebra is called axis, and the seventh cervical vertebra is called vertebra prominens. So what are the features of the third, fourth, fifth, and sixth cervical vertebra? The body is small, concave superiorly, and the lateral margin of the superior surface is elevated. We call it uncinate process. That means the superior surface is beveled. There is foramen transversarium. There is the foramen in the transverse process of all the cervical vertebrae. The spinous process is short and bifid. There is some variation in some racial population. It may not be bifid, but it is always bifid in people of European descent. Vertebral foramen is triangular and large, comparatively large vertebral foramen, and will give emphasis on the anterior tubercle, on the transverse process of C6 cervical vertebra, because the common carotid artery can be compressed there between the anterior tubercle of the C6 cervical vertebra. This is the anterior tubercle. Okay, we got that, the anterior tubercle. So if you go to the 1, 2, 3, 4, 5, 6, then the anterior tubercle here, the anterior tubercle and this part and the body of the vertebra, we can easily compress the common carotid artery. Okay, so this is called the carotid tubercle of C6. Okay, so to the atlas, if you go to the atlas, the first cervical vertebra, atlas, it articulates with the occipital condyle of the skull above and with the superior articular process of the second cervical vertebra. So this is the superior articular facet, and this is the superior surface of the atlas. This articulates with the condyle of the occipital bone, and the undersurface here, this will articulate with the superior articular facet of the axis. The atlas has no body, it is lacking body, and it is lacking the spinous process, and we must know that the joint between the atlas and axis, there is no intervertebral disc between atlas and axis. The atlas has 2 lateral masses. These are the lateral masses, and a anterior arch here, and it is the posterior arch. You have the anterior tubercle and posterior tubercle. This is the superior articular surface. Inferior articular surface is underneath it. Here it is more or less rounded. This is concave bean shape or kidney shape. This is that, and we have here the processes. Here the site of attachment of the transverse ligament of the atlas. Here, site of attachment of the ligament that hold the dents here. Okay, so attachment for the transverse ligament of the atlas here, site of attachment, and this is a facet for articulation with that of the dens. Okay. The atlanto-occipital joint allows nodding movement of the head. Okay, and certainly these move, all the joints has movement, so they are synovial joint and atlanto-occipital joint. This is a condylar type of synovial joint. Posterior surface of the anterior arch has an articular facet for dens. Dens is the tooth-like process from the upper part of the body of the second cervical vertebra. The dens is held in position by transverse ligament of the atlas that is attached here, and this is the dens here. Okay, anterior tubercle, posterior tubercle, transverse foramen. Transverse process is very much prominent in the atlas. It can be palpated between the angle of the mandible and the mastoid process. The transverse process is large and provide attachment to the muscles acting on the atlantoaxial joint. Many muscles are attached there. We have the rectus capitis muscle here. Here we have the oblique muscle. Scalene muscles are attaching here. So a lot of muscle. And this is the groove for the vertebral artery. Artery is going through that, coming through that and going through that. Ultimately, vertebral artery goes through the foramen magnum to the base of the pons and forms on both sides. Vertebral artery unite to form the basilar artery at the base of the pons of the brain stem. Okay, we got. So this is the site. This part is related to the vertebral artery and the C1 nerve here. Okay, axis. It is a large tooth-like dens. Okay, this is a tooth-like process. Embryologically, this part is the body of the atlas that has been separated from the atlas and it is attached to the body of the axis. The dens act as a pivot that allows the atlas and the skull, that means head, to rotate on the axis, side to side movement. The dens provide attachment for the alar ligament. Here is site of alar ligament here on this side, on the other side. We have also apical ligament here. And we have to know that the atlas spinous process is usually by feet. Okay. Now I'll go to the seventh cervical vertebra. The seventh cervical vertebra is also called Vertebra Prominens because it has prominent spinous process. Very long spinous process. Tip of the spine can easily be felt through the skin if you pass a hand at the nape of the neck, the nuchal furrow, lower part of our hand will palpate the spinous process of the seventh cervical vertebra. The spine is thick, long, and nearly horizontal. This is thick, long, and nearly horizontal, but it is not bifid and end in a tubercle. The spine provides attachment for the back muscle, many back muscles, like that of the trapezius muscle, the levator scapulae muscle. Okay, a lot of other muscles are attached here. The rhomboid minor muscle. Okay, and many other muscles. And also it is a site of attachment of the ligamentum nuchae. The transverse foramen or foramen transversarium is small. It may be divided into two. It may be absent. This foramen is comparatively smaller than that of the other transverse foramen or foramen transversarium of other cervical vertebra, and it does not transmit the vertebral artery. It transmits accessory vertebral vein. Okay. Okay. Now learn some clinical anatomy. Well, our cervical vertebra is prone to be dislocated, and we may have injury or trauma. It may be any type of violence. It may be fall on the head down on the swimming pool, or it may be due to severe blow on the upper part of the head. Okay, or maybe even the horizontal part of the neck. So what will happen? We may have two type of fracture. One, this is the fracture of the atlas, the anterior arch. Here, posterior arch fracture. Lateral mass a little bit separated is lateral mass. This is the dens or the odontoid process of the axis. So this may not cause quadriplegia provided the ligament is not broken or the dens is not pressing on the upper part of the spinal cord, lower part of the middle oblongata. Okay, so this may be depending on the type of injury and the extent of injury. It may or may not cause quadriplegia. Here, Hangman fracture, there is hyperextension, and there is fracture here, pars intra-articularis fracture, and in hanging, the platform under the foot is separated. There is very quick hyperextension that damages the axis. Okay, so that may lead to quadriplegia and may cause the shutdown of the vital center in the lower part of the middle oblongata. And that's all about the anatomy of the cervical vertebra. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.